Hi everyone, my name is Kashari Davis, as you already know, and I'm here for week 3 for my patient presentation. Um, and this week, on September the 16th, which was Monday, we saw a patient named Mrs. JC. Those are her initials. She was a 67-year-old Caucasian female that states she has bilateral ear pain. The patient is also concerned about sinus pressure, leg cramps, nausea/vomiting, diarrhea, and postnasal drip that is thick and yellow. The patient denies any abdominal pain. So her chief complaint is bilateral ear pain, purulent, um, postnasal drip, leg cramps, nausea, vomiting, diarrhea, and frontal sinus pressure. And she says it's been going on for a week. The HMP, the patient is concerned about bilateral ear pain, purulent postnasal drip, leg cramps, nausea, vomiting, diarrhea, and frontal sinus pressure. The patient states that she doesn't take any medications besides lisinopril, HCTZ for a history of hypertension. The patient is postmenopausal. The patient states that she has regular bowel movements and usually urinates regularly without any problems. The patient denies the use of street drugs, alcohol, and denies smoking. The patient states that the symptoms that she is having started 1 week ago. The patient denies anything making the symptoms better or worse. The patient states the pain/pressure on her frontal sinuses 5 out of 10. And for her past medical history, the patient admits past medical and a family history of illness after review of symptoms for the patient and family. She says that for her family history, she has hypertension. Well, sorry, her father has hypertension and prostate cancer, and he's still living, and that's his history. And her grandmother has hypertension, as well as chronic kidney disease stage 2 and diabetes type 2 for her mother. Social history, she denies tobacco, e-cigarette usage. She says she drinks alcohol socially when out with friends and has no more than 2 drinks. She is single and works at Walmart as a cashier. And she has one male child that is 41 old, and he lives in Douglasville, Georgia, not too far. She has an allergy to Benadryl. Surgical history, she had a hernia repair in 2010. And medication she takes, as I told you before, in the HMP, she takes lisinopril, HCTZ, and she takes 20 milligrams slash 12.5 milligrams PO daily. And she received all her childhood vaccines, and her flu shot was last given December of 2018, and she denies any psychiatric history. For her review of systems, she says generally she doesn't have any weight change, no weakness, fatigue, increased hunger, thirst, and no increased urination or no headaches. For her skin, no rashes, lumps, sores, itching, dryness, color change, changing nails or hair, bruising or bleeding, excessive sweating, heat or cold intolerance. For her head, mild frontal headache, she says, denies head injury, denies dizziness, eyes, no vision change, corrective lenses, pain or redness, and no excessive tearing, no double vision, no blurred vision or blindness. Ears, no hearing change, no ringing in the ears. She does admit ear pain of 5 out of 10 bilaterally, and does deny recent infection and denies discharge from her ears. For her nose sinus, she is positive for rhinorrhea. Her frontal, she says she's been having postnasal drip and it's been purulent. She does say she has frontal sinus pain, 5 out of 10. No nosebleed, she denies that. Her throat, no. For her throat, she says she doesn't have any problem swallowing or anything like that. Um, no lumps, no swollen glands, um, no goiters or pain or neck stiffness. And for her neuro, she says she doesn't have any seizures. She denies seizures, paralysis, numbness and tingling, tremors, or involuntary movements. Um, and patient does state that she feels that she does have a little bit of weakness. Pulmonary, she denies uh, cough, denies wheezing. Peripheral vascular, she does admit that she has some leg cramping, 5 out of 10 pain, no varicose veins. She denies a history of blood clots, denies a history of any abdominal, flank, or back pain. And she denies any color change in her tips or toes. Um, and she denies swelling or redness or tenderness. For musculoskeletal, she denies muscle and joint pain and joint stiffness. GI, she denies um, changes in appetite or excessive hunger or thirst. And jaundice, she does have she said that she was having nausea and vomiting, so she's positive for that. No difficulty swallowing, no heartburn, no pain, um, and she has had positive changes in bowel habits, which was the positive. She was positive for diarrhea 3 times a day, no food intolerance. G, for her urinary, she denies flank pain, dysuria, um, denies urgency and frequency, denies polyuria, denies incontinence. And she denies any vaginal discharge, no swelling or history of STDs. And her last menstrual period was 7/15, and that was in 2007. Now for the objective data. Sorry, I had to cut my phone on silent. For the objective data, her general survey, she's comfortable and has normal skin tone for her ethnicity. The patient looks relaxed without distress. Um, for her head, eyes, ears, nose, and throat, mucous membranes are dry, normal, skin turgor, no tinting, postnasal drip present, and is purulent in color. Um, the right ear has extreme dried cerumen, and the tympanic membrane is not visible. The left ear is clear. The left ear tympanic membrane is bulging. Cardiovascular wise, S1 and S2 without murmurs, and she doesn't have any gallops or rubs. No S3 or S4 rubs. No lower extremity edema. Respiratory, her respiratory uh, Respirations are quiet and unlabored, able to speak in full sentences. Breath sounds clear to auscultation. No wheezing, rhonchi, or any adventitious lung sounds. Um, her abdomen, no discoloration. Um, Positive hyperactive bowel sounds in all quadrants. No bruits, no friction sounds over spleen or liver. No hernias. Denies flank pain on CVA tenderness assessment. And for her musculoskeletal, um, she does complain of left leg cramps intermittently. Um, Rectal, no abnormalities. And her heart rate is in the 70s. Her blood pressure is 110/72, which is really good for her. Respirations are 16, and her O2 stat is 98% on room air. Differential diagnosis consists of sinusitis, upper respiratory uh, tract infection, and chronic invasive um, fungal sinusitis. The diagnosis that I gave this patient was sinusitis slash otitis media. And the reason I did that is because she's having the frontal sinus pressure, as well as the exam. When I looked into her ears with the otoscope, it looked like she had an ear infection, bulging tympanic membrane. Those are signs of an ear infection. Um, So to me, this patient sounds like she has sinusitis with an ear infection as well. So I'm going to prescribe amoxicillin 1 gram PO, which is by mouth, every 8 hours for 7 days, and have her buy over the counter Debrox for wax removal in the right ear. Drink plenty of fluids, and then have her take ibuprofen 800 milligrams PO. 4 times a day for 7 days for pain, and Claritin 10 milligrams every night to help with that postnasal dripping, things like that. And then two, her hypertension. That's another problem she has. Continue the lisinopril HCTZ 20 milligrams slash 12.5 milligrams PO every day. Monitor blood pressures, but her blood pressures are great, so that medicine is working fine for her. Number three, she complained of leg cramps, um, and I already told you, but I still put it in the plan under the leg cramps that we're going to do that ibuprofen 800 milligrams PO 4 times a day times 7 days. And then we're going to do a complete metabolic panel. I just want to see where her electrolytes are and check for dehydration, check for potassium issues that can lead to leg cramps and stuff like that. And being that she's been having diarrhea and nausea and vomiting, I just want to make sure she's not dehydrated. Nausea and vomiting, her fourth problem. CBC to check for how severe her infection is. And I told you about the CMP, just to make sure she's not dehydrated, make sure her electrolytes are okay, that make sure we don't need to replace those, especially because she's on a diuretic. And then Phenergan, 12.5 milligrams PO, PRN every 8 hours for nausea and vomiting. That will help control that issue, and have her drink plenty of great Gatorade, plenty of water, plenty of fluids to keep her hydrated. 5, this is her fifth problem, the diarrhea. Um, I ordered Imodium AD. And I already did the questionnaire for possible C. diff, to see if she was like on antibiotics prior, to see if that might be causing the diarrhea, because if so, you shouldn't really use Imodium for patients like that, because they could die, or something serious could happen because of a C. diff infection. But she denied being on any antibiotics recently, and she has not had any recent hospital admissions or anything like that. So I wasn't really concerned about her having C. diff. Um, so the C. diff questionnaire was negative. But she'll be on Imodium AD, 2 tabs PO times 1, and then 1 tablet PO after each loose stool, and then have her follow with the Bratz diet until symptoms improve, and then follow up in 2 weeks. And also education about sinusitis, of course, ear infections, hypertension, nausea and vomiting, and diarrhea and dehydration. Give her education about that. And like I said, just have her follow up in 2 weeks. All right. Thank you guys. And I look forward to reading everyone else's soap notes for this week and looking at your presentations. Thanks.